I'd like to talk to you a little bit about the types of training that are recommended for people with diabetes. In fact, there are four main categories, which I'll discuss in more detail in other videos. But we have aerobic or cardio training, resistance training, flexibility training, and balance training. So let's talk about aerobic or cardio. If you remember, in talking about the energy systems, we actually discussed the aerobic energy system, which is the one that we kicks in to take over, the one that we use predominantly for anything lasting longer than 2 minutes or so. It has almost unlimited amount of fuel that it can use between carbohydrates, fats, and minimally some proteins. But what we like to do is use this system on a regular basis because it helps use up muscle glycogen, it helps manage blood glucose, and overall is good for increasing cardiorespiratory fitness. So there are many ways to do this. You can do it by the things that you think of as cardio type of training: walking, running, swimming, cycling, those typical things, but also dancing and other things also are use that same aerobic energy system. One of the ways to get adequate amounts of this is to aim to try to do it at least every other day. So for people with diabetes in particular, they recommend not going longer than 2 days without some type of training, just because it keeps your insulin action higher. So the goal is to aim for 150 minutes a week of moderate training, which means that you're working hard, but not so hard that you can't carry on a conversation. And spread that out over the course of the week so that you don't have a big gap. You're not just a weekend warrior. You can also get away with doing a lesser amount of a harder workout, so more intense workout. In that case, you can get by with 60 to 75 minutes per week. So it's kind of like a double amount. If you do moderate, you have to do double the amount of you would have to do if you do intense workout only. Another way to get around that is to do high intensity intervals of any type, which means going a little bit faster. If you're walking and you take maybe 90 steps per minute, if you take 100 steps per minute for half a minute or so, and you do that periodically, that actually adds up and increases your fitness faster. It uses up more blood glucose and is a better way to increase fitness.